Hi, this is Terry Kuti with Deep Sea Foundation, and I am with three women today. Two of these women have had their breast reconstruction already, including myself, but we also have another guest today who is in the planning stages of having her breast reconstruction very soon. So, what I would like to ask each of you, because you've all been through this, is let our viewers know, what is it that you did to find that just right plastic surgeon? Because no matter what type of breast reconstruction you have, whether it's implant based or autologous, no matter what type of autologous you're having, there's different parts of the body that you can use. We have all had DIEP. Tamara is going to have DIEP. What is it you look for in a plastic surgeon, and how did you find your surgeon?
Gosh,
Whitney?
For me, it sort of evolved. I had about 2 years to do my research and pick my surgeon. And at first it was.
I'm going to pull you in just a little as we're talking. There we go. Thanks, Whitney. Sorry for the interruption.
No worries. At first it was mostly about the surgery itself. I knew that I wanted the DIEP flap reconstruction.
Right.
As I learned more about what that surgery entailed, I knew that I wanted someone that could do nerve reconnection for me so that I wouldn't be completely numb. I also wanted someone, I learned later on throughout this process, I wanted someone that was focused on healing after the surgery and preparing for the surgery and not just the procedure itself. So I wanted a surgeon that, was very thorough in my life as a patient and helping me get through the entire process and not just the procedure. And that can be hard to find, but it was something that was very important to me, which I didn't realize at the beginning of my journey. But in the end, I ended up finding an amazing surgeon that really helped me prepare for months leading up to my surgery, and has been incredible after. I'm 4 weeks out now, and it has been really wonderful in following up and helping me, with physical therapy and all these other things that most women want and need after the procedure itself. So
you're really talking about pretty much, it sounds like a holistic approach to your reconstruction, and that was part of your criterion.
Yeah.
Okay.
Yeah, a surgeon that looked at me as a patient but also a woman.
Sure. Your lifestyle.
Yeah.
Everything.
Wanted to help me get through the entire process and not just the procedure itself.
Sure. How about you, Rene?
I just wanted to ask you, Whitney, did you interview other doctors at all?
I did. I actually interviewed 6 different doctors.
Wow.
Yeah.
Yeah, so Whitney, myself, and the other ladies here actually wound up at the same place. Some different doctors, but the bottom line is that I too interviewed several, and I think what it comes down to is a feeling of comfort, and it's a gut feeling that instantaneously, kind of like dating or looking at a house and it's the one. It's just
you're building a relationship.
It's something that you just feel is the right move for you. And the fact that it was a travel related event for me, and really for all of us, it was the least of my issues. My priority coming out of some complication after the initial mastectomy was to find someone who could almost promise me no complications. Well, nobody can promise you that. But I looked at their track record, their success percentage rates, the volume of procedures that they were doing. I needed very specific details about what happens before, during, and after. Who's available to me before, during, and after? What is the true timeline, not the picture perfect timeline, but what dictates the timeline? What can I do to contribute to it going as smoothly as possible? And I think most importantly is that the doctor that I chose reminded me constantly to keep my frame of mind in check and to keep it positive. And I turned on that focus and I never let go of it. And I think that's why I had a really successful experience before, during, and after this procedure, and since then.
That's a great
It's critical.
Tamara, how did you go about finding your surgeon? Because you're there in a few weeks. You're
Right.
going to have your surgery.
Yeah, I'm scheduled May 9th, and I'm traveling for my surgery as well, which, I did research other surgeons, and there are really good options out there, but I also looked at success rate. I wanted a really high success rate, and I also asked them what is their definition of success, because through my research I found that some surgeons, if the deep flap survives 24 hours, they consider that a success. Well, I would not consider that a success if the flap only lasted 24 hours. So the surgeon I went with, it's the flap that they do. It lasts, it lives, and then they also, their success rate includes that the woman is happy with the results. So they
Aesthetics.
will, yes. That they will, make sure that you like the outcome. Infection rate was also important to me. I looked at infection rate not just for the surgeon but also for the hospital. And then also I was very interested in a surgeon that did the nerve reconstruction. If it's possible, they will do it, and that was really important to me. And then of course just rapport with them, someone that you feel comfortable with, that makes you feel comfortable, and that they have done a lot of these. I also wanted someone that had just a lot of experience doing these. So
something that I'm hearing all of you say, and something that I'm very passionate about as a patient advocate, is a term called shared decision making. And that is when you as a patient bring all of this research that you have all talked about to your consult, you bring it to the table, you're sitting with your plastic surgeon, and he or she listens to you, honors all of that work that you have brought to the table, listens to your aesthetic desires and outcomes, and then they share with you what they think is going to be best, realistic, as you said, Rene, for your best outcomes, but also for your best health. So it's a joining together of two people that share their separate knowledge and experience. It's not the doctor telling you what to do. You're at this level and you bring those thoughts together for that shared decision-making model, which it sounds like all of you guys had. So I thank you very much for your information, Dave. I really appreciate it. And thanks for being here.